Hello, and welcome to the Everyone Counts 2019 Pima County Street Count Community Training. This is an online version of the community training that happened last week, and we thank you so much for taking the time to complete this training online to help better prepare you as a volunteer for the street count this Wednesday, January 23rd, 2019. During this training, we're going to talk about a number of things. We're going to start by introducing you to TPCH, the Tucson Pima Collaboration to End Homelessness, talk about what the goal of the street count is and why we do the street count, talk about count day, what you can expect as a volunteer the morning of the count, Wednesday, January 23rd, talk about your role on your team and the other roles that exist on your team, how to conduct a successful survey and how to do so safely. We're going to look through the survey and look at the individual questions and talk about why we ask them and how to ask them properly. We're also going to talk about how to keep that information that you collect safe and confidential and how to begin planning with your team. So who is TPCH? TPCH is the Tucson Pima Collaboration to End Homelessness, and they're a coalition of community and faith-based organizations, government entities, businesses, and individuals who strive to reduce and end homelessness in Pima County by addressing issues that are related to homelessness in our community. And TPCH is such a valuable group in our community, and they've been working with the county and other service-based organizations, including the University of Arizona's Southwest Institute for Research on Women, who does the evaluation for street count, and they all work together to make this effort happen. So what's the goal? Why are we doing the street count? The goal of the count is to get a count of everyone who's experiencing homelessness in Tucson and Pima County, which is no easy feat. It's a very large area, and in order to get a count of everyone, it takes a tremendous amount of effort and volunteers to come together and canvass this area in such a short time period, which is just really from sunup until about noon on January 23rd. So why do we pick that date and time to go across the city and count homeless folks in the way that we do? Well, it's because it's required of the U.S. Department of Housing and Urban Development. This is a point-in-time count. The street count is also called a point-in-time count, and this is something that happens across the nation on this date at that same time. And the reason HUD chooses this time is because it's during the winter, and most places are colder than Arizona, and so folks are in shelter, and we're able to do a shelter count the night before and get a pretty good estimate of how many people are experiencing homelessness from that shelter count the night before. So here in Tucson, we do that on the night of Tuesday, January 22nd. We will do a similar survey with all folks in shelter that evening. But for folks who don't go into shelter, we do the street count the following morning to try and catch folks who weren't in shelter and understand what their experience of homelessness is like. And then we use this information, we share it with HUD in order to make arguments for funding, but we also use this information to better understand who are the homeless folks in our community and how can we develop services to help get them housed and get what they need. We also use the data that we collect to understand how well the services are doing at ending homelessness. We're able to look over time if there's a reduction in homelessness and see if the population is changing and there's different services that need to be developed. So we use this data in a number of ways, and it has been helpful to us over the years, and we have seen a reduction in homelessness. So the point-in-time count is a really important effort and does help to bring change to the Pima County community. This information is also used at the national level. HUD uses this information to inform Congress about the type of funding that's needed and the types of folks experiencing homelessness across the nation. So where do we survey? We survey all of Pima County, which includes the city areas, the deserts, all of the outlying areas, rural areas like Ajo, Marana, Catalina, Vail, 3 Points. All of these areas, Green Valley, Sahuarita, are included in the count. We do these in different ways, but primarily we divide this area up into sectors, which are the teams that you get assigned to. And then your team lead, which we'll talk about in a minute, helps to determine the best way to canvass that sector and go through and find people and do surveys. So that is what your job is, to survey all of Pima County and complete interviews with folks experiencing homelessness. So you'll need to be assigned a role in your team, but most likely you're an interviewer, someone who's going to be conducting surveys, looking for people experiencing homelessness and conducting surveys with them. So in order to do this, it's important that you connect with your team, share contact information across your team with the other volunteers who are assigned to your team. Find out where your team is meeting the morning of the count, and then before that time, make sure that you've practiced the survey. On the day of the count, you'll arrive at the meeting location that your team leader has shared with you, and once there, you'll pair up with your team members. So everyone should get grouped in pairs, if not in larger groups, so always in at least a group of 2. And then in your pair, you'll go off into the area that you've been assigned by your team lead and start looking for folks experiencing homelessness. And when you come across someone who you think might have experienced homelessness, you'll approach them and use the survey to help start a conversation with them. And then if they have been experiencing homelessness or slept outside the night before, you'll read all the questions on the survey as written. And if any challenges arise, you'll communicate those challenges with your team lead. And then as you complete surveys, you're going to proofread them for legibility. All of the surveys that you complete are going to get turned into your team lead, who's then going to turn them into headquarters. And at headquarters, then that information will get turned into some data entry folks. And those are going to be read, by a person's eyes and then entered by a person's hands. And so it's really important that that person's able to read your handwriting. And that's tricky out in the desert or out on the streets in the cold in the morning when you maybe have gloves on. Sometimes writing becomes challenging, but that's okay. We all have our different styles of writing. Just make sure that when you're done, you go back over your survey and make sure that it's something that someone else can read. Otherwise, the survey becomes not usable. So what are the different roles on your team? There's team leaders and interviewers. Sometimes there's assistant team leads, but they really have the exact same role as a team lead. So team leaders are the leaders of your sector. Their job is to connect with all the different members on the team and ensure that those team members have completed this training and signed a waiver, confidentiality waiver. And you should have received this confidentiality waiver in an email to you. Make sure you print that out and sign it and email that either to your team lead or to the pima.street.count@gmail.com email address. You can also take a picture of it signed and text that to the Pima work group phone number, which you should have in the email, or to your team lead. If you're not able to do any of those things, your team lead will have some confidentiality waivers with them the morning of the count, and you can sign one before you go out, but that must be signed. Your team lead will also manage the group in the area, so they'll have gone through the area and determined which, what the plan of attack is, how you're going to canvass the area, how you're going to survey the area. Hopefully your team lead will have identified different businesses or organizations that homeless folks might be accessing, like libraries or churches or bus stops or laundromats or convenience stores, and will help coordinate you and your team members to go and pursue folks in those areas. The team lead's also the point person for any emergencies or unclear terms. So if you're conducting a survey and you have a question, your team lead is the person to call. And if an emergency arises, that's not a true emergency, again, call your team lead and they'll contact headquarters to get the support that y'all need. If it's a true emergency, just call 911. Your team lead's also going to serve as the liaison between headquarters and the team. So volunteers who are interviewers shouldn't be calling headquarters, only team leads should. Team leads are also going to be responsible for ensuring that the team has enough gift cards, surveys, volunteers, and they'll be coordinating with headquarters to get those things as needed. It's also their job to make sure that all surveys are legible, so when you turn those things into them, they're going to have to double check them. So make sure that you've helped out your team lead and get those surveys legible before you turn them in. and then your team lead will take all of those completed surveys to headquarters by noon on Wednesday, January 23rd. And as an interviewer, your job is to complete this training, so good step. Sign that waiver that we just talked about, and complete surveys accurately with all folks experiencing homelessness. Make sure that those surveys are legible and easy to read, and then be a positive representative for TPCH and the Everyone Counts 2019 Street Count. And what that means is, you're out in the community meeting and talking with folks. Make sure that you're doing so respectfully and with grace and with kindness. The folks that we're trying to reach have a pretty rough day to day, and we should be there to make things easier for them as best we can while doing these surveys. So what do you need for the day of the count? You're going to need a team information sheet, and that's been emailed to you. You can print that out and fill it out with your team's information, so the different contact information of your team members. You can bring that with you the morning of the count and fill it out there when you meet your other team members, or you might be able to do that ahead of time. Depends on how things go for you. But that's an important sheet to have with you. You could also take a picture of it if you don't want to carry it around with you during the day of the count, but it's an important information to have with you when you're out in the field. You'll also might want to consider bringing a clipboard and a pen. It's hard to complete surveys just in the air or on your lap. It's really helpful to have a hard surface to write on, and a clipboard's the best way to do that. Your team lead will have some clipboards, but may not have enough clipboards for everyone on the team. So if this is something you have or can borrow from an office, please bring one with you. It's going to be pretty cold, most likely, the morning of the count. So it might be a good idea to wear warm, layered clothes, because the temperature will probably change over the course of the day from 6:30 a.m. to around 11 a.m. Temperatures will definitely change, so you want to be able to add or take away from layers of clothes. Make sure you're wearing comfortable walking shoes. You're going to be walking some distance, most likely, and you may be walking in a wash. So make sure those shoes are closed-toed and comfortable for you to walk in different types of terrain. It's a great idea to have a cell phone with you so that you can call when you have questions or emergencies, or to get different types of assistance for folks you're surveying. It's a good idea to just kind of keep your cell phone tucked in your pocket until you need it. But that is something that's an important tool to have with you. Also bring water. You're going to be out for a number of hours walking. It's a great idea to bring lots of water with you, and maybe some coffee too. What not to bring isn't listed here, but it's a good idea to leave all valuables in the car or someplace safe. You're going to be walking some distance and encountering lots of different types of people. It's best not to be wearing anything too flashy or anything that draws attention to yourself or to the person you're interviewing. You have to think about confidentiality, and when you're wearing loud, bright jewelry or clothing, those things draw attention to you and probably draw attention to others while you're surveying. So it's a good idea to just kind of dress pretty casually, comfortably, and leave purses and backpacks, things like that, back in the car. All you really need are these things here. So who are we going to be approaching? Who are we looking for? We're looking for anyone that slept outside the night before January 23rd. So anyone who slept outside on Tuesday, January 22nd. And, that could be someone who's experiencing chronic homelessness and has all their belongings with them and is obviously kind of stereotypically looking homeless. Or this could be someone who you would never suspect is homeless. They don't look like they're homeless. They just slept outside for 1 or 2 nights and are just beginning to experience this, or have are very good at camouflaging themselves. And so how do we figure out who's homeless and who's not, and who's had this experience and who hasn't? The best way is, if you see someone that's walking in your area, to approach them and ask them, hey, I'm out doing the Pima County Homeless Street Count right now, and I'm trying to find folks who slept outside last night. Do you know this area? Do you know where I might look for someone who is experiencing homelessness or who might have slept outside last night? And if you approach people in that way, they will either identify themselves as someone who's had that experience, or they'll point you in the right direction for where you might find others who have. So I find that that's the best way to find out if someone's experiencing homelessness. is just to approach all people without assumption, and then to ask if they know where to find folks who are experiencing homelessness or slept outside. So following up on that, you're going to approach folks, introduce yourself, explain what you're doing, explain that the survey is confidential, and at the top of all surveys, there's a script, and you'll use that script to do these things. Once you start doing a survey with someone, when someone said that they have experienced or are experiencing homelessness, or I did sleep outside the night before, you'll read the script and you start the survey, and know that people can start a survey and stop anywhere they like, skip any question they like at any time. So this is completely voluntary, and people can decline any and all portions of the survey. Folks are going to receive a $5 gift card to thank them for their participation in the survey. And this is for folks who complete 2 questions and for folks who complete the entire survey. So if they do any portion of the survey, they're going to get $5 gift card. So you can tell them, hey, thanks so much for doing the survey. I'd love to buy you breakfast or lunch. It's a $5 McDonald's gift card. And then we'll also be able to share some support information for folks if they're a veteran, a youth, someone under the age of 24, or someone who's interested in getting connected to the coordinated entry system. If they're interested in accessing services for folks experiencing homelessness, we can also offer them different types of services, and we'll go over more of that in a second. So how do you complete a successful survey? Like I've mentioned, you're going to approach everyone you think might be experiencing homelessness, introduce yourself, explain what you're doing using the script on the survey, and then begin doing the survey. You want to make sure that only you as a volunteer or that other volunteers are completing surveys. There should never be an instance where you hand the survey over to the person you're interviewing and allow them to fill out the survey. This creates a number of problems for us, and we really appreciate if you're the only person completing the survey. And sometimes you might have someone say, well, I'd rather write down my own answers, or I'd rather read it and just do it than have you ask me the questions. And of course, that person's welcome to look on with you and welcome to watch what answers you select and what you write down, but that person isn't allowed to complete the survey themselves. That's something that only you can do. And so if someone makes that request of you, just say, I'm so sorry, but the rules for the street count are that I can only complete these surveys. And then just put the onus on us. Say, I'm not even sure why, I just know that that's the rule and I have to follow that rule. And it helps us to ensure that all questions are understood in the same way and read to folks in the same way. Please honor people's requests to skip questions or not participate in the survey. If someone doesn't want to participate, don't be worried that we're missing that information. It's more important that we respect folks' privacy and respect folks' wishes to not participate in the survey if they don't want to. So feel free if someone says, I'm not interested, just to walk away and end things there. For folks who that you do talk to, be sincere and thank them for their time, whether they participate in the survey or not. We appreciate that folks let us walk up to them and just start asking questions of them, and you should be sincere and thankful in those interactions. And then, of course, share gift cards, cold kits, and other resource information as needed. Cold kits may not be something that you have on your team, but they are on people's teams for areas that don't have McDonald's nearby. It's unfair to give gift cards to folks when they can't make it to a McDonald's on foot. So we also share these things called cold kits that have sometimes like a warm hat, gloves, scarf, socks, things like that. In order to conduct successful surveys, it's important that you think about the space around you. Think about the space between you and the person you're talking to, and the space around you to maintain safety for yourself and for the person that you're interviewing. So just kind of be aware of who's within earshot and eye shot. If where your body is, if the situation arose, would you be able to get out of that situation quickly? Is your back up against a wall or in a tight or enclosed space? Here in this image, we can see a man and his back is up against a wall, but he's able to move quickly left or right and get out of a situation if need be. He's also maintaining an appropriate distance between himself and the person he's talking to. You want to make sure that you're thinking about other people's comfort level and safety and giving people the space that they need. You also want to protect people's privacy. So by looking around, seeing if there's other folks within earshot, and if there are, ask the person that you're about to survey, hey, are you comfortable answering these questions right here? Would you rather walk over here away from the crowd, or would you rather walk, and leave it up to that person to determine what makes them feel comfortable. If situations do arise, be sure just to remain calm and try to de-escalate any situation that gets tense or uncomfortable. If there's a question that you've asked or something that's happening nearby that's creating tension, skip that question, move on, or help move that person out of a situation if you can. Some things to be cautious of while you're completing these surveys is being careful about surveying outside your area. You're assigned a very specific sector, and people nearby you are assigned adjacent sectors. And so when you start surveying outside of your area, you increase the chances that we'll interview someone twice. Because, right, if someone's in a certain area, like a church, for example, and then you cross over because you're sure that there's folks in that church, but it's outside of your survey area, another volunteer worker may have already targeted that church and surveyed folks there. So make sure you know where your boundaries are and then stick inside those boundaries. If you have questions about something that's crossing over a boundary, talk to your team lead about it. They can call another team lead and make a plan for that. Determine who's going to survey something that's crossing over a sector. Be really cautious about duplicating surveys. This becomes a problem for us when we start counting people multiple times. So if you suspect that someone's completed a survey before, ask them, it seems like maybe you've done this already today. I could give you another gift card to thank you for your time right now, but we don't want to do 2 surveys with one person. And we'd much rather give someone an extra gift card than have 2 surveys on record for one person. Be very careful about deviating from the survey. It's really important that every person have the same experience in the survey, that everyone have the opportunity to answer every question on the survey, and that the survey be administered in the same way across the county. So make sure that you're reading the questions just as they're written and not making any assumptions about which questions are appropriate for people. All questions on the survey are going to be appropriate as long as you follow the skip patterns, and we'll go over that in just a minute. Please, again, don't allow people to complete or fill out the survey themselves. Only interviewers should be completing out the surveys. And as you're collecting information, keep that information confidential. If you learn something interesting or hear like a really heartfelt story while doing an interview, unfortunately, you need to keep that information to yourself. You can't go and then share that information with a teammate. Like this, I just heard the most amazing story. Like that's not appropriate. The amazing story that you heard was shared with you in confidence while completing a survey, and that information isn't yours to share with someone else. So please be respectful of the information you're collecting and don't share that information with anyone else. And that's part of signing that confidentiality waiver. You're agreeing to keep all of the information you collect private and confidential. Please be cautious of any judgments you might be making, whether you say these things out loud or you're making faces while someone's responding. Someone's taking the time to share very intimate information about themselves, and we need to be very respectful and be careful about how we're reacting or responding to the information that we're hearing. So it's best not to really make any statements as people share information with you. It's best just to note it down and move on to the next question. Be careful not to mandate participation in the survey. You're offering this survey to folks. If they don't want to participate, that's just fine. And please don't offer to give folks additional services outside of the gift cards, cold kits, or resources that we have to share. I know it's hard sometimes when you see someone in need not to want to give them money or offer them a ride or promise that their services are going to make it to them. But the reality is we can't share these things. We have the $5 gift card to share, cold kits, and then some resource information, but that's really where it ends. And we can't promise that these surveys are going to bring any specific type of service or housing. We can say that we'll use this information to try and develop services or improve services, but please don't make promises about service changing or services that are going to come to folks completing these surveys. In order to remain safe, it's really important that you stay in pairs, that you follow the buddy system and not separate from your team. We recognize that in order to conduct a survey confidentially, you'll have to separate from your pair, but make sure you guys are within eye shot with each other. Have a plan for when you both are maybe completing a survey at the same time, that you at least stay within each other's field of vision. Come up with a plan that works for you and your teammate. Be cautious about clothing and possessions that you have on you, and trust your instincts. If something feels wrong, just leave that situation. You don't need to force yourself into bad situations to conduct these surveys. You can always call your team lead if you have questions about what's safe and what's not. But for the most part, I think and take yourself out of bad situations. Maintain safe and respectful distances from the folks you're interviewing, and think about the homes that you're going into. These aren't traditional homes that we normally think of, tents and cardboard boxes and even places where people are sleeping on the street. These are their homes for the day or for sometimes, months or years. So you make sure you call out before walking into someone's space, because that's their home, that's their yard. Especially when going into encampments, as you walk near a camp, you can see tents or makeshift houses. Make sure you're shouting out, is anyone in the camp? Anyone home? And that'll help to bring folks out, and that way you don't have to walk up and approach people's tents. It's important not to do that. Be cautious about touching people. Just generally, it's not really something we'd advise. You don't want to be waking people up or invading their personal space. If you see someone that looks like they're asleep on the ground, call out to them and say, hello, I'd like to talk to you. Are you awake? Do you have a moment? And if they don't rouse, then, just move on. Also be cautious about dogs. A lot of folks have pets with them. Again, calling out ahead of time and saying, hey, I'd like to speak with you. Is it safe for me to approach your dog? Is it safe for me to pet your dog? Talk through things, communicate. Make sure that you're communicating in a way that ensures your safety and the safety of others. If bad situations do arise, call that team lead, or if it's a 911 situation, just call 911. So we've talked about body language a little bit, but it's important to not crowd anyone. When completing a survey, it's best to aim your body at a 95-degree angle, so kind of shoulder to shoulder, where they can look on the survey if they'd like to and see what the questions are as you're reading them. And then this also allows them to maybe look at your responses and helps to build trust while you're doing the survey. They can see that you're writing down exactly what they're saying. You also want to maintain body language that's at the person's level. So not only do you want to be angled at that 45-degree angle, but if someone's lower than you, you want to lower yourself down. You shouldn't be looking down on someone, or vice versa. They shouldn't be looking down on you. You want to try and get to their level. So you can see here's some examples of a man that's crouched down, sitting on a bucket of some kind while there's someone in a tent. This person probably didn't want to come out of their tent, and that's fine. They called probably into the camp, and this person popped their head out and said, sure, come on over here. And the person came in and asked to sit down, and then began introducing the survey and themselves. This person over here to the right, just walked up to someone and started talking to them while they were sitting. This isn't the way it should be. You need to get down to that person's level and allow them to look onto the survey with you. So angle at that 45-degree. So here is the survey. You should have a copy of this emailed to you for practice. You can pull that out right now if you'd like, or you can just follow along with me here on the screen. So here you see that we have the individual survey. It starts by asking location, interviewer name, date, and time. This information is really important, though it's not questions that we ask of the person we're interviewing. This information tells headquarters about where surveys were completed and when, and helps us with deduplication. If a survey was completed at a location on the east side and the west side at very similar times that has very similar information, we would know that these surveys are likely two different people that just happen to have the same information and can be counted two different times. Whereas if a survey has very similar information and was completed at different locations, but at very different times, it's possible that that person moved from one side of town to another in a course of time. And so we use this information to try and determine when surveys are similar, if it needs to be deduplicated or not. So thank you for making sure that you fill that portion out correctly. And when it comes to location, it doesn't need to be super specific. It can be something like Circle K, corner of Ina and Orange Grove, or if it's out in a desert area, Canyon del Oro Wash, or Wash near, Rito Park, something like that. We don't want GPS coordinates there. That's not helpful to us, and we don't have the resources to look up GPS coordinates. So thanks for not being too specific. So like I said, when you see someone who you think might be experiencing homelessness and you want to find out, that's best to walk up to that person or call out to that person and say, hey, my name's Corey, and I'm a volunteer for the TPCH, and I'm doing a survey with folks that are experiencing homelessness right now. Do you know of anyone nearby who might be experiencing homelessness or who might have slept outside last night? And then let that person respond. If they say, yeah, I did, then you're going to go and start that script again and say, okay, yeah, so like I said, I'm Corey, and I'm a volunteer for the Tucson Pima collaboration to end homelessness, and I'm conducting a survey to count people who are experiencing homelessness to provide better programs and services to them. Your participation is voluntary, and your responses to questions will be entered into the Homeless Management Information System, HMIS, which is shared by homeless service providers. And I need to read each question all the way through. Are you willing to share about 10 minutes of your time to answer these questions? And then the person will either say yes or no. If they say yes, great, you're starting a survey. If they say no, then no, and survey ends there, and they do not get a gift card because that's not completing the survey, right? That's just completing the qualifying question of whether or not they want to complete a survey. So if they say no there, then just say thanks for your time and you're done. If they say yes, then you're going to start asking questions, starting the survey with what is your first and last name? And the person can respond however they want. They can share their first and last name. They can share just their first name. They can share an alias or nickname, or they can choose not to answer that question at all. Then you'll ask, what's your date of birth? And again, the person can decline to share, or you can write down what they like. Maybe they just want to give you the month and date, not the year, or maybe they just want to give you the year. You take what they give you. Then you'll ask, where did you sleep last night? And you'll notice next to this question, there's brackets with all capital letters in it. These are instructions for you as an interviewer, not something that you read aloud. So throughout the survey, you'll notice instructions like this, and this is just to help guide you through the survey. So it says, do not read categories, select only one category. So people can only respond with one of these options. So where did you sleep last night? And then the person will tell you. They might say, I slept in a camp. And you'll look on here and you don't necessarily see the word camp, but you do see desert or outdoor encampment. So you select that one because it's the best fit. Someone might share something that's not on here, and then you could put that down under other, or you could have them while they're looking on with you and say, I'm not sure what that is. Does that fit into any of these categories? And the person might tell you, oh yeah, Primavera is a shelter. And then you would know to select shelter. If someone has stayed in that area that's bracketed there, where emergency shelter starts and hospital or treatment program ends, all of those responses are going to lead to that instruction that says end survey. Say thank you for sharing your time and taking the survey. So if someone slept, when you ask this question about where someone slept last night and happens to be in any of these areas, then we're not going to do a survey with them because we likely already surveyed them while they were in a shelter, or they don't qualify as sleeping outside last night because they were in a motel or a house or apartment or jail or prison or a hospital. All the others above emergency shelter, though, would qualify, and you'll move on to the next page. And you'll ask, did another volunteer or survey worker already ask you these same questions about where you slept last night? If they say yes, that means they've already done a survey. And again, you're going to end the survey and say thank you for your time, and give them a gift card if it feels necessary. If not, you're going to continue on with the survey. How old are you? And then allow them to answer. If they don't want to tell you how old they are, then you're going to say, okay, would you tell me what category of age you are? Are you under 18? Are you 18 to 24? Are you 25 or older? And then you can check the one that they respond to. If they're still unwilling to share their age with you, then you can either calculate their age a little bit later when you're done with the survey by looking at their date of birth if they shared that. If they didn't share that, then we're asking you to go ahead and just make an estimate of their age. And you could select the under 18, 18 to 25, 25 plus, or make your own estimate of the number. You could say this person looks about 65 and write that in there. This is crucial. In order for HUD to count our surveys, we have to have some type of age determinant, which is why we ask this question in so many different ways. So if we don't have date of birth, then we need this. We just need some type of way of capturing the person's age, even if it's by your estimate. So please don't skip this question. Otherwise, the entire survey becomes unusable. So what are the last 4 digits of your Social Security number? Please enter that. If they don't want to share it, that's fine. You just move on. And if they ask why we're asking for their Social Security number, it's for deduplication purposes. We want to ensure that we aren't counting a survey twice for one person, or that we don't count 2 different surveys that just happen to be the same. Are you a U.S. military veteran? The directions say check yes if the person has ever been on active duty in the armed forces or the United States, regardless of discharge status or length of service. And then you'll ask, what is your gender? And allow them to respond. A lot of times folks are worried about asking this question because they think people should know what their gender is by looking at them. So sometimes you might say, what is your gender? And someone might respond to you by saying, can't you tell? And it's important to not make an assumption here, to not say, what is your gender? Oh, you're male, right? So we want to ensure that we're asking the questions and allowing someone to respond. So if someone does come back at you and say, well, can't you tell? Just say, I just have to read every question on here as written. I know it's silly. Will you tell me what your gender is? And then the person should tell you their gender, and you could select the one that's most appropriate. Female, male, transgender female, transgender male, gender nonconforming. And folks who fall into those categories will know what their gender is and be happy to tell you. What is your race? You can say more than one race. Do not read categories. So you're going to ask, what is your race? And tell them that they can say more than one race, and then allow them to just respond without reading those categories out loud. And then as people tell you multiple races, you'll select the different races that they say. If they only say one race, then you'll just select the one. Then you'll ask, are you Hispanic or Latino? Yes or no. Sometimes what'll happen when you read number 7, what is your race? Someone who's a Hispanic or Latino might identify as being their race as Hispanic or Latino, which is fine. However, we don't have that option because that's not how HUD captures race and ethnicity. So if someone says, when you ask number 7, what is your race? They say, I'm Mexican or I'm Hispanic. Then what you're going to do is pop down to number 8 and select yes. And you'll say to them, so you are Hispanic or Latino. If they say yes, then you'll select that. And then you'll come back up to race and say, are there any other races that you identify with besides Mexican or Hispanic or Latino? And then if they do identify in some other way, then you can select those things. If they don't identify with any other race besides being Hispanic or Latino, you'll just select don't know. Number 9, what best describes your sexual orientation? Listen and check 1, read categories if needed. So first you'll ask that question and allow them to respond. If they seem confused by what the word sexual orientation means, then you can say, so what best describes your sexual orientation? And someone says, well, what's that? What does that mean? Say, okay, do you identify as heterosexual or straight, gay, lesbian, queer, pansexual, bisexual, asexual, something else? And then select what the person shares. They can only check 1 response though. About when did you become homeless this time? And when did the person start staying on the street in emergency shelters or safe haven this time? So people experience what we call episodes of homelessness. They'll be homeless for a chunk of time, and then that chunk of time will come to a pause because they'll be housed for a minute, and then maybe they start experiencing homelessness again. So asking them this most recent time that they're experiencing homelessness, when did that first start? And then we're just looking for the month and the year. If they can't remember, some folks have been experiencing homelessness for a long time, or just outside really eking through their lives and have a hard time remembering dates and times. It's okay for them to make an estimate. And then you'll ask, including this time, so including this most recent time that they've been homeless, how many times have you been homeless in the past 3 years? That is since January 2016. So here we're looking at how many times over the past 3 years this person has experienced homelessness. Has it just been 1 time, 2 times, 3 times, 4 or more times? So perhaps someone is experiencing homelessness right now. They were in a staying with family for a month back in December over the holidays, but were homeless before that, and then have been homeless a few different times over the last 3 years. And you would just help them to try and come up with their best guess about how many times. And then number 12, if you add up all the times you've been homeless in the last 3 years, about how many total months have you been homeless in the past 3 years? So those times that we just talked about back in question 11, they were add up all those chunks of time that they were homeless. How many months would that add up to? So if they were homeless 1 month back in before December, and have been homeless a month since December, and have had a number of other times, you start helping them to add those months up, and they can make their best guess. Then here we stop and only ask questions 13 to 15 for people who are 18 years of age or older. We can't ask these questions for people who are under 18. So if someone's under 18, then we need to skip to question 16. But if they're 18 or over, we can ask these questions. So number 13, please tell me if you have any of the following disabling conditions. Do you have alcohol abuse? And then allow them to say yes, no, don't know. Drug abuse, both alcohol and drug abuse, chronic health conditions such as diabetes, cancer, heart disease, or something else. Do you have AIDS or an HIV-related illness, a developmental disability? Do you have a mental health issue such as post-traumatic stress disorder or PTSD? Schizophrenia, bipolar disorder, chronic depression, chronic anxiety? Do you have a physical disability or have you had a traumatic brain injury? So you'll go through all of those questions. Some things that can come up in these questions, especially are around alcohol and drug abuse. Sometimes you might ask that question of someone, do you have drug abuse? And someone might say, well, I smoke marijuana every day. Is that drug abuse? And so they'll sometimes turn the question back at you. And it's important that you not respond for this person. So then you turn it back on them. So if someone says to you, well, I smoke marijuana every day, is that drug abuse? You would turn back to them and say, well, you tell me, do you feel like your marijuana use is, do you feel like you're abusing marijuana? And then they'll tell you yes or no. And then you write down what they say. Similar with alcohol abuse. Someone might say, I drink every day. Is that alcohol abuse? And you just say, well, you tell me, do you feel like you have alcohol abuse problems? And they'll tell you. Some people might have alcohol abuse or drug abuse problems but not currently be using, but they do consider that alcohol abuse or drug abuse a disabling condition for themselves. And so if they ask that of you, the answer is it can be yes. So you just turn it back on them and say, well, do you feel like alcohol abuse is a disabling condition for you? Regardless of whether or not you're currently using. And if they say yes, then the answer is yes. Be careful about trying to describe any of these things, such as chronic health conditions or mental health issues. If a person's been diagnosed with these things, they typically know. So if they come back at you and say, I don't know if I have schizophrenia, can you tell me what that is? You can just say, I'm really not a specialist in this and I can't describe what schizophrenia is. Is that something you've been diagnosed with? And then just allow them to say yes or no. If someone says yes to any of the questions on question 13, then you're going to go ahead and ask questions 14 and 15. If they haven't said yes to any of these conditions, you're going to skip to question 16. So assuming that someone has said yes to a few of these things or one of these things, you'll ask, is this condition expected to be long-lasting? And then you'll ask, does this condition impact your ability to live independently? And then question 16 is a question that you'd skip to if someone was under 18 or if they had said no to all of the questions in the table in 13. Are you currently experiencing homelessness because you are fleeing domestic violence, dating violence, sexual assault, or stalking? Number 17, do you regularly use services in the community aimed at supporting people experiencing homelessness, like shelters, case management, transitional housing, or other kinds of services? Notice there's a skip pattern here. Yes, no, don't know. If someone says yes, that they do regularly use services, you're going to move on to question 19. If someone says no, or they're not sure if they regularly use services, then you're going to read question 18 and find out what keeps them from using services. So number 18 asks that, what keeps you from using services for people experiencing homelessness? And then the directions are to select all that apply. So someone can answer in a number of ways here. So you ask that open-ended question and let them respond. What keeps you from using services for people experiencing homelessness? And someone might say, well, my dog, they won't let my dog in. So you look through this list and then you find what's the best fit. And in this instance, it would be pets. And then ask, is there anything else that keeps you from experiencing or from using services for people experiencing homelessness? They say, well, yeah, I'm also have substance use problems and I have to stop using in order to go in. So then you would choose, okay, say, well, is that alcohol or is that substance use something besides alcohol? And say, oh, no, it's substance use. And you select that. You can also put down things that don't fall into the list under something else. And you can write down as many something else as someone has to share. We really want to have an understanding of what keeps people from using the services that already exist so that we can improve on those. Question 19, is there anyone else in your household who slept in the same location with you last night? If yes, you'll ask question 20. If no, then the survey's over and you'll skip down to the closing statement and read that. If don't know or they don't want to answer or tell you if there were other people sleeping in the same location as them last night, again, you'll read the closing statement and thank them for their time and give them their gift card. But if they say yes, you're going to ask, what are the names of the people who slept in the same location with you last night? And then write down what they're willing to share with you, whether that's first and last name, first name, nickname, whatever. Just write those things down. And then you'll ask, are you the head of the household? So this group that they're talking about, are they the head of that household? And there's no reason to give a definition here. Just say, are you the head of that household? Are you the head of your camp? Wherever they're staying, are you the head of that household? And they can determine whether or not that's true. It's kind of a complicated idea to define, and HUD defines it in a very specific way, but we're going to let people self-define whether or not they're the head of the household. 22 asks then, how many people in your household who slept in the same location with you last night probably won't complete a survey like this today? So this is trying to get at folks who might be staying back at a camp or somewhere else that isn't going to come out and about that day. Maybe they're protecting the camp, or maybe they're not feeling well. And we want to ensure that we're counting all people experiencing homelessness, even folks that might not be out and about that day. So this allows us to do that. So when we ask that question, we write down the number of adults and children that might won't be able to complete a survey, who maybe stayed in the same area with them. So this might also be people that are out and about with them, like children, but for some reason won't be able to complete a survey, maybe because of language barriers or developmental disability, or because they're too young to complete a survey. And then ask if this person, so the people that they've said, so let's say this person says, yeah, there's 2 people back at my camp who aren't going to be coming out today. Then you're going to ask if you can complete the family member count form with them. And the brackets tell you that there. If 22 equals 1 or more, complete family member count form. If 22 equals 0, you're going to end the survey and move on. So if everyone that was in their household who slept in the same location with them is out and about and can complete a survey, then this person is done, and so are you with this survey. However, if this person has people that aren't going to be out and about, you're going to pull out the family member tool, which looks like this. It looks almost identical to the individual tool, except it's a different color, and it's titled Family Member Tool. And this tool allows you to complete a survey on behalf of someone else that's not going to be present. So basically, you'll pull this form out if someone's told you, yeah, there's people back at my camp that aren't going to be here. And you'll ask them if they're willing to answer the questions on those people's behalf by completing a family member tool with them. So the person that you initially interviewed may complete more than one survey, one for themselves and then one for folks back at their camp, or maybe for children that are with them that are too young, or family members or others that are with them that aren't able to complete a survey because of language or a developmental disability. So you'll only complete these surveys in third person, and that's how this survey is different. Notice that the questions read, how is this person in your household related to you? Just to confirm, did this person in your household stay in the same location with you last night? Where did they sleep last night? And it has then the same exact questions that you just went through, but in third person rather than first person because someone is answering on someone else's behalf. And that's the only time we would use this tool. We wouldn't use this tool if, let's say there's a family in front of you, there's a woman and her sister and her auntie. Just because they're all family, you wouldn't use the family member tool. Each of those people, the woman, her sister, and her auntie, if they're all able to answer the questions on the survey, they would each do their own individual survey. The family member survey is only for people who aren't present or who aren't able to complete a survey for themselves for some reason. And you can give that person who completes these family member surveys as many gift cards as they complete surveys. So if they do 1 for themselves and 2 for 2 family members back at the camp, they'll get 3 gift cards. And if you have questions about this, please point them towards your team lead. I know it's a little complicated. So just to recap, it's really important that we ensure that all forms are legible. This is going to be entered manually, and we need to be able to read the surveys. Otherwise, they become useless in your time, and the person you're surveying's time then becomes wasted. And it's also important that if you have questions or notes, it's fine to write those directly on the survey. Like, for example, let's say you ask someone a question and they answer one way, and then they change their mind, and then they switch back, and you scribbled things out. It's fine, scribble it out, and then in the margin, just write, the answer to number 1 is yes, or is this, or I wasn't sure how to answer this question. This is how the person responded. And write those things down, and then we may be able to figure that out on our end during data entry, or maybe not, but it's great to have those notes there to at least try. Make sure you're entering that specific location information for deduplication purposes and the time. Be sure that you're only using 1 form per person. So not a time to save paper. We need a new form for every person you're interviewing. And then use a new family member form for each time that someone answers on someone else's behalf. It's really important that your first experience doing a survey isn't with someone out in the community. That's really unfair to that person to be your practice. So make sure that you take a minute. The survey doesn't take long to do it all, about 10 minutes. So find a friend, a coworker, a family member that you can complete this survey with until you feel comfortable administering it, because it's going to be easier to do it with someone you know. It's going to be a little harder to do it with someone you don't know. So make sure that you're at least comfortable with folks you do know before you start asking it of people out in the community. Practice will also allow you to come up with any questions that you might have, and you can then have those questions ready for your team leader, either before the count by emailing them or calling them, or on the morning of the count before you head out, you can ask questions to make sure you're good to go and ready to complete surveys with folks in the community. You might encounter some special populations while completing surveys. You might encounter folks that are under the age of 24. You might encounter some veterans, or folks that are interested in housing services. If you do encounter any of these people, you'll use that information form that I talked about earlier, where you where you write down your team member's contact information. On that form, you also have the phone number for a youth specialist, a veteran specialist. And so if you come in contact with a youth or veteran, you can tell them that you can connect them to services if they'd like. And if they would like, then you call the phone number to the youth specialist or to the veteran specialist and help coordinate that person to get some services. They may be able to get services in that moment, or they may just schedule a time to get services later. It just depends on that person's situation. We also are trying to have someone who can complete a VI SPDAT on each team. And a VI SPDAT is another tool that is used in the community to help connect folks to housing services. And it basically is a survey that scores a person's level of need for different types of services. So if you encounter someone who says, I really need housing, can you help me? Or I really want to get connected to services, can you help me? And they're not a youth or veteran, you're going to call the person that's on your team that can do a VI SPDAT. So you should know that at the beginning of the day, who's doing VI SPDATs. And if you are a person who knows how to do a VI SPDAT, please bring those VI SPDATs with you from your agency. We won't have those in your kit, so just bring those with you and have those on you. And if folks want to complete one, they can, but it's not at all necessary. We aren't trying to complete VI SPDATs with everyone. If you do complete VI SPDATs, make sure you tell your team lead that you've done so and how many you've done. Your team lead's going to communicate that information back with headquarters. And then you'll take those VI SPDATs that you've completed back to your agency and enter those as you normally would. These aren't going to get turned into headquarters with the other surveys. Your team lead will also have a map of the area. When you go to turn your surveys back in that you've completed, it's a good idea to look at the map and then mark down where you completed surveys. This will really help to give us a visual of where surveys were completed when we're doing data analysis. And it's great if you can put down an I if you completed an individual survey, or an X. Put down a Y if you completed a survey with a youth. Put down a V if you completed a survey with a veteran. And then make note of how many VI SPDATs were completed. There's also a youth count the night of January 23rd. So we're counting in the morning, and in the evening there'll be a specific youth count that's at the Goodwill Metro on the corner of 4th Avenue and 8th Street. And the Goodwill Metro will be having a count where there's going to be pizza and different folks that work with homeless youth completing a different survey. So if you encounter youth, they can complete the survey that you're offering, but they can also go and participate in the youth count. And there's flyers for the youth count in your box. Make yourself aware of those and maybe grab a few to have on you. And if you encounter youth, please help refer them to that youth count. It's unlikely that you'll encounter media in the field, but if you do, please be aware of how that media might hinder confidentiality. So please don't speak on behalf of TPCH or CIRO or be a representative for Street Count when it comes to the media. Direct them to headquarters or to your team lead, and we can help share information that's important with the media. You want to make sure that there's not media around that make folks feel uncomfortable while they're completing surveys, or that breaks confidentiality. Here's a copy of the waiver that we've been talking about. You should have received this in your email. There'll be some in your team leads kit the morning of the count. Make sure you sign one of these before you begin counting. We need one of these for each person. Otherwise, you're not able to participate in the count as a volunteer until we have a signed confidentiality waiver. And this waiver basically says that you're aware that you're going to be collecting information that's personal and private, and that you're willing to keep that information safe and confidential. It also talks about risks associated with participating in the street count, and that you're aware of those risks. So please take a minute to review that and sign before the morning of the count. Once again, make sure that you make all the information that you've written down legible for your team lead and for data entry folks. The better the legibility, the more accurate the data, and the better the data, the better it's going to be for everyone. So thank you for making things legible. All right, well, that's all we have for you today. There's still, I'm sure, a lot of questions you might have. It's hard to cover everything in such a short period of time, but feel free to email any questions you have to pima.street.count@gmail.com or to your team lead. People have been participating in the street count for a long time and have lots of information to share, so there's no silly questions. Feel free to email those at any time. So thank you so much for your time today. That's all we have for you, and we look forward to seeing you this Wednesday, January 23rd, 2019, at the Everyone Counts Street Count. Keep an eye on your email for more information to come.